In the 18 months since the start of the pandemic, the death toll among residents in long-term care and assisted living facilities is grim. More than 800 in the first year. In a report, BC's senior advocate dives into what went wrong in the first two waves of the pandemic.
This review focused on the more narrow question of outbreaks and how can we control them.
The report looked at 487 facilities and found 76% of first cases that led to an outbreak in a long-term care facility came from a staff member. In only one case originated with a visitor from March 2020 to March 2021. Mackenzie's recommendations include expanding sick leave for all facilities to 18 days annual sick leave, as many staff came into work sick. She's calling to increase the number of staff, registered nurses, testing, and decrease the number of nurses on contract. Most facilities now have eliminated shared rooms, and the government's policy on mandatory vaccinations for staff goes into effect October 12th.
I'm not surprised by many of the findings. They're similar to what we had in our report after the first wave, especially around testing.
The BC Care Providers Association represents private facilities caring for 12,000 seniors in residential care.
I think we'll have to see that here in British Columbia to meet the challenge of having staff that are ready and available and willing to work in long-term care.
So it's your birthday next week, Mom. You know you're going to be 90.
I know.
Jeanette Harper recently celebrated her mother's 90th birthday at Nanaimo's Eden Gardens long-term care home. Harper's happy with the idea of more nurses.
I'd love to see more nursing staff, more and more care aid hours per resident.
As far as the recommendations from the seniors advocate, they are not binding on the provincial government.